Many moles that develop during adulthood are related to sun exposure and effects on melanin production. They are often benign, but some changes can indicate cancer. Welcome back to MKGI Skincare, where glow that matters. What are moles? A mole, or nevus, is a normal skin growth that develops when pigment-producing cells in monocytes grow in groups. They appear as small, dark marks, or sometimes flesh-coloured small bumps on your skin. Moles can appear in a range of different colours, shapes and sizes. For example, one type of mole is the blue nevus. Blue moles look blue because the group of pigment-producing cells is lower in the skin than brown freckles and moles. They might look unusual, but are generally benign. Most people have moles. Only about 1 in 100 persons has a mole or moles present at birth. These so-called congenital melanocytic nevi are often bigger than acquired nevi moles that develop after birth. Moles typically appear in childhood and early teenage years, so that by the age of 15, Australian children have an average of more than 50 moles. Types of moles that increase melanoma risk: atypical moles. Melanoma can grow in an atypical mole. Anyone who has atypical moles, such as this patient, should watch his or her moles for change. Melanoma can grow in an atypical mole. Anyone who has atypical moles, such as this patient, should watch his or her moles for change. Your dermatologist may call an atypical mole a dysplastic nevus. Nevus is the medical term for mole. When your dermatologist is talking about 2 or more moles, you may hear the word nevi. Atypical moles can appear anywhere on the body. They often appear on the trunk. You can also get them on your scalp, head, or neck. Atypical moles rarely appear on the face. Congenital mole. When a person is born with a mole, the mole is called a congenital mole. Roughly, 1 out of 100 people is born with a mole. These moles vary in size from small to giant. Having a giant congenital mole increases a person's risk of developing melanoma. This congenital mole was small when the girl was born. When it started to grow, her dermatologist removed it. Spitz nevus. This mole can look like melanoma. In fact, it can so closely resemble melanoma that a dermatologist cannot tell by looking at it. Most Spitz nevi are pink, raised and dome-shaped. A Spitz nevus can also have different colours in it, like red, black and brown. The mole may bleed. It can have an opening that oozes. Most Spitz nevi appear on the skin during the first 20 years of life. Adults also occasionally get Spitz nevi, acquired mole. When a mole appears on the skin after a person is born, it is called an acquired mole. Most people who have light skin have about 10 to 40 of these moles. These moles also are called common moles. If a person has 50 or more of these moles, the person has a higher risk for getting melanoma. Management and treatment. Your usual healthcare provider might refer you to a dermatologist, a healthcare provider who specializes in skin. Should skin moles be removed? A normal skin mole does not need to be removed. If you choose to have it removed, you'll likely be left with a scar. How are skin moles removed? Don't try to remove a mole by yourself, even if you're using some sort of over-the-counter product that burns, freezes, or uses lasers to remove skin growths like skin tags, moles, and freckles. Not only could you get an infection, but you could unknowingly remove melanoma skin cancer. Skin cancer can spread to other organs if it's not caught early, and one way to catch it is to identify an abnormal mole. Which is better, tonic or toner? For more exclusive videos, click subscribe and push the notifications bell. Thank you guys for watching, and see you again in our next episode. Namaste!